Optimal breastfeeding practices are key to a child's survival. The World Health Organization says globally, 3 in 5 babies are not breastfed in the first hour of life, and over 820 million children could be saved yearly if all children between 0 and 23 months were optimally breastfed. Today on Sound Health, our focus is on improving breastfeeding practices. I am Olasumbo Modupe. Thanks for joining us on Sound Health. The conversation begins after COVID-19 updates.
The World Health Organization (WHO) has alerted of the falsified Covishield coronavirus vaccine recombinant in circulation. The falsified products were reported to WHO in July and August. The genuine manufacturer of Covishield, Serum Institute of India Pvt Limited, confirmed that the falsified products were first reported at the patient level in Uganda and India. WHO has warned that Delta variant of COVID-19 is on the path to becoming the dominant strain worldwide as the surge in the highly transmissible variant increases urgency for vaccinating large numbers of vulnerable people. It said that rising infection rates resulting in increased hospitalizations are overwhelming health systems and leaving many countries in urgent need of life-saving oxygen. WHO further warned that while 4 variants of concern currently dominate the epidemiology, there are fears that new and possibly more dangerous variants of concern may emerge. The federal government has commenced the rollout of its second batch of coronavirus vaccine, the 4,080,000 Moderna vaccine doses donated by the United States of America. The National Primary Healthcare Development Agency (NPHCDA) said that the donation was to step up efforts to battle COVID-19 infection in the country. The agency also disclosed that about 698,880 doses of the Oxford AstraZeneca vaccine are being expected and will be targeted at those due for their second dose of the AstraZeneca vaccine. The country is expecting up to 3.9 million doses of the AstraZeneca vaccine to complement what is available.
It's still Sound Health on Lagos Television. Speaking more on how to scale up nutrition through breastfeeding is Beatrice Eluaka, Executive Secretary, Civil Society Scaling Up Nutrition in Nigeria. Thanks for joining us this evening, madam.
Thank you very much for having me.
All right, breastfeeding is a natural skill and tradition that cannot be overlooked in nurturing babies. It transcends societal status. How important is it to a child's survival?
Thank you very much. Just like you said, breastfeeding is a very important issue and practice for child survival. Breast milk has been naturally prepared by God, who made us, as food to nurture the young infant. And for us in Nigeria, breastfeeding is a practice that we are all very familiar with. Unfortunately, we are not doing it the way it should benefit the child. Now, when a child is born, we recommend that the child is put to the breast within 1 hour of delivery. And that is to enable mother and child to have some interaction that will make the milk to start coming. And that first milk that comes out, it's usually yellowish in color. It is called colostrum. is packed with very good things for the child that the child needs for survival and for development. What am I talking about? I'm talking about the protein that the child needs for growth, the carbohydrates the child needs for energy, and the fat that the child also needs for energy and to also for growth. And more importantly, it is the child's first immunization. Take here, borrowing the words of the UNICEF head of nutrition, who was speaking the other day. She called it super vaccine. Breast milk, she referred to the breast milk as a super vaccine, a super food, and a great investment. Not only investment, not a good investment only for the child, because it supports the child's growth and development, but also investment for the rest of the family. Because we know that the child who is exclusively breastfed for 6 months, notice that I said exclusively for 6 months. And that means giving the child only breast milk and nothing else but breast milk. Not even water, no supplement. Unless, of course, that supplement is recommended by a medical person to treat any condition. But at 6 months, it is important for us to know that breast milk alone is no longer sufficient to sustain the child, because the child is growing and the child is moving around and requires more energy. So at this time, it is important that breastfeeding continues with adequate complementary food for 2 years or beyond. That is the recommendation. And so that is the importance of breastfeeding. It is the child's first immunization. It provides all the nutrients that the child needs for growth and brain development. It also makes the family to be comfortable, because the child does not present with illnesses that will cost the family more by going to pay hospital bills and so on. So those are the benefits. We know from experience, from mothers who have done exclusive breastfeeding, and from research, that children who are breastfed optimally are also come out to be very, very intelligent. And of course, when this happens, they grow up to become very productive adults who can take over from us when they grow up.
All right.
So these are the benefits of importance of breastfeeding.
Despite all these benefits, there are also lots of challenges with breastfeeding, such as poor or low milk supply, engorgement, sickness, limited support from the family. How do you enhance or make up for this vacuum now?
Thank you very much. Yes, there are challenges, and that is why our breastfeeding rate in Nigeria, although we have made some significant progress, is still low. Because the rate is 29% now. We moved from 17% in 2017 to 29% now, which is still below the World Health Assembly targets for exclusive breastfeeding. The target for 2025, where we still have a long way to go to meet up that target. Now, the challenge is that the mother is not producing enough milk is usually perceived and not real. But yet, let us talk about it. What makes the milk come is the baby's suckling. When the baby is suckling and the baby is well attached to the breast, the message is sent to the brain. Oh, baby needs food. Make more food. And the milk is coming. So as long as the baby is suckling, whenever on demand, we say on demand, that is whenever the baby
Baby's
needs
hungry.
it, both day and night, then the mother will be producing enough breast milk for the baby. The mother also needs to be supported because a mother who is stressed may have difficulties to do breastfeeding optimally. And that is why we are recommending family support, beginning with the husband and father of the child, to ensure that anything that will cause stress for the breastfeeding mother is removed. So breastfeeding can go on well for baby and mother when we as family members, as neighbors, provide the necessary support. And when we as health workers also provide the necessary knowledge and skills to help the mother to do effective breastfeeding. There are also myths around breastfeeding that we need to work on. One of them is the issue of water. We as adults, we eat and we drink water. Why would a child who is breastfeeding not drink water? Those are some of the questions that we get. And it is simple. Do not give water. Number one reason is that the breast milk is made up of between 80% and up to 90% water. So there is no need to add additional water because the baby's stomach is very small. And by the time you add water, you give the baby water, and the baby starts breastfeeding, the baby gets filled up quickly without getting the nutrients that are present in breast milk. Maybe I should say that breast milk has also two components. The first part that comes out of the mother's breast consists of just sugar and water. And that is what we call the fore milk. And then way into the field as the baby suckles and suckles, then the hind milk comes. And the hind milk comes with plenty of fat and other nutrients. And that is what makes the baby fully satisfied after taking breast milk. So we need to ensure, that is why we always say, allow the baby to suckle on one breast and remove his or her mouth by herself or by himself, and then you offer, the mother offers the next breast. If the baby is fully satisfied, he or she may not take the second breast. But if he still continues, allow him or her to continue breastfeeding. And then at the next meal, you start feeding the child with the breast that he has not suckled. So those are the things that we need to do to ensure that breastfeeding goes well for both mother and baby.
All right, what is the role of nutrition in breastfeeding? Do you require a special skills to breastfeed a baby now? Because if a mother is breastfeeding, he or she needs to feed fine now, feed well now. What is the role of nutrition, and do you require a special skill?
Nutrition plays a very major role in breastfeeding, and it begins even before the baby comes, during pregnancy. And that is why we talk about the first 1,000 days of the child's life, which is very important. And this 1,000 days begins with pregnancy and up to when the child is about 2 years old. Now, before and during pregnancy, the mother needs to eat adequately. Just enough for her to gain energy to go through pregnancy and breastfeeding when the baby comes. So the mother is actually not eating for two, in quotes, like people will say. And the Oyibo man will tell you that only a glass of milk is sufficient to add, to the mother's need during pregnancy and lactation. But for us, the mother should eat adequately what she normally eats, and maybe a little more, and she needs to drink more water for herself in order to be able to breastfeed adequately. There is no special diet, I must say, but just eat what we used to call a balanced diet, which is an adequate diet that will give the mother, that will cater for the mother's need for her own body, and then need for energy to be able to do breastfeeding effectively. So that is the message, yes.
All right. This year's theme is Protect Breastfeeding, Shared Responsibility. How is it a shared responsibility now?
Thank you. It is a shared responsibility because we now know that the responsibility for breastfeeding does not just lie with the mother and the baby alone. Everyone has a responsibility to that. Let me start with the government. Government has a responsibility to put in place family-friendly policies that will help breastfeeding. Government has a role to play in ensuring that hospitals and our hospitals have skilled birth attendants, skilled. When we say skilled, we mean people who have been adequately trained and have the knowledge and skills to support the mother when they come for antenatal care and after the baby is born, to help them to put the baby to the breast as soon as possible, within 1 hour of delivery. So that is the role of government. The government also has a role to ensure that the International Code of Marketing of Breast Milk Substitutes is implemented fully and is also enforced, so that our infant food manufacturers will know their limits in terms of promoting breast milk substitutes. Yes, we recognize that there may be a little percentage of infants who may need this breast milk substitute, but the code also specifies how these breast milk substitutes can be utilized. So the code needs to be adequately implemented and enforced by government.
All right.
Now, I leave the government. The family, the immediate family, has a responsibility. And that is what we have talked about earlier, providing support. The grandmother, the mother-in-law, the husband, male involvement, all of these are very important to promote exclusive breastfeeding. And before I move on, I forgot to mention the issue of 6 months maternity leave. Government has to ensure that there is 6 months maternity leave, all the states and even in the federation, to enable mothers who are pregnant to go on 6 months maternity leave, to enable them do the 6 months exclusive breastfeeding. This is very important. So far in the country, I think only 4 states have laws, promoting 6 months maternity leave. And I'm happy to say and to congratulate Lagos State for being one of those 4 states. So we need to work hard to ensure that other states also implement the 6 months maternity leave.
All right.
Now, the community also has a responsibility. So it is the World Breastfeeding Week is saying, let us all join hands and support exclusive breastfeeding. That is what the shared responsibility is all about. So it is everybody's responsibility, because employers of labor also have a responsibility, because when the woman resumes work, after 6 months. There is need to make the workplace conducive for the woman to also bring her baby to the office to breastfeed when the baby needs it. So these are things that we can do. And so you can see that it is not just the mother's responsibility to ensure adequate breastfeeding.
Beatrice Eluaka, Executive Secretary, Civil Society Scaling Up Nutrition in Nigeria. Thank you so much for your time. We appreciate you.
Thank you so much for having me.
Trending Health Report is next. Please stay tuned. This is all we have time for today on Sound Health. Whatever you do, ensure you stay safe always. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.